Preparing your frontline leaders for success is our episode topic. Rejoining us as guest is Lowell Hardin, a master's prepared registered nurse with BRG's clinical transformation team. Lowell's prior leadership roles include serving in nurse manager and nurse director positions in multiple organizations, and he is also currently the fire chief in his local community. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Lowell, welcome back. It's great to hear from you again.
Glad to be back. Thanks for having me.
Now, you were on an earlier episode back in season 2, episode 14, to talk about hospital-based EMS. Can you just give us a quick reminder of introducing ourselves to your listeners for those that didn't have a chance to listen to that episode?
As you stated, I'm a registered nurse, master's prepared, leadership in various size departments across the country, EDs, inpatient, outpatient. I also work in the fire service, a paramedic there, and I've had leadership positions in the fire service as well.
Now, you recently finished training over 100 frontline nurse leaders in an academic medical center. Many of these participants held the title of assistant nurse manager, but I understand the course can also be adapted for those in permanent charge nurse positions based on the individual structure and makeup of our particular client. Why did the hospital decide to provide this training for their frontline leaders?
It started with the request to train the leaders in the emergency department. And we provided that training to the assistant nurse managers in this academic medical center. And then based on the feedback from the participants, they decided to expand the program to the leaders throughout the organization.
Why is it important for BRG to offer this training during some of our clinically focused process redesigns?
As you know, nurses have great training when it comes to clinical areas, but there's very limited training for nurse leaders outside the clinical arena. And as nurse leaders progress through the leadership ranks, they need some education and some support to learn how to lead people. And we developed this course to give them some of that basic knowledge. And as we work with them as BRG, it actually helps them become better leaders and helps their performance improvement as well as their leadership of their teams.
So talk to me a little bit about the mechanics of the course. How long is it? How many people attend each class?
The course is an 8-hour course, so it's a long day for nursing, and it's broken down into several topics: leadership behavior, operational leadership, accountability, delegation, a couple of different sections on communication. And we try to limit the class to 12 people and no more than 15.
Why so small? Why not 30 or 40?
This is an interactive class, and the goal is to meet the leaders where they are, learn from them. And so the class of 12 allows interaction, it allows questions, it allows a lot of time for real-time scenarios and discussion.
Okay. What's the audience? Is it charge nurses, assistant nurse managers, directors?
This is a leadership course, and the course was originally targeted towards the charge nurse / assistant nurse manager role. The good thing about this course is it can be adapted and can even be taught to managers and directors, and we've had positive feedback from directors that have taken the course.
Now, you said charge nurse / assistant nurse manager. I mean, clearly those are two different roles. So why are we grouping them together, or is this just, it kind of depends upon how the organization is using those roles and things of that nature?
So organizations have different titles for different roles. In some organizations, the assistant nurse manager functions as a charge nurse level. In other areas, the assistant nurse manager has a group of charge nurses or staff reporting to them. So it depends on the organization. And again, we look at the mechanics of the organization and the structure and adapt the course to the structure of that organization.
Is the content the same based upon the audience that's attending, or is there some adaptability there as well in fluctuations. Because while assistant nurse managers may be out on the floor, their responsibilities on the managerial side with human behavior is maybe a little bit more advanced than that of a charge nurse.
And you're correct in that. The topics of each section of the presentation stay the same. We actually adapt the content and expand it based on the leadership role of the audience that's attending.
What's the value in this over just encouraging nurse leaders to go back and get their master's degree in nursing leadership or go back and get their bachelor's degree and take some leadership courses? Why this format?
As education is important, and I would never discourage nurses going back for advanced licensure, advanced certifications, advanced training. This course is very operationally based. It's not just sitting in a classroom generically talking to a group of people. We have topics, but as we have the interaction that we discussed earlier, we actually answer real life questions and use real life examples that they bring to the table. So it allows a conversation from the attendees and meets their needs where they are.
Can you share some of the feedback you received from this group of 100 leaders?
One of the comments that I thought was very interesting, and it occurred more than once, was I really didn't want to come to another mandatory course and spend 8 hours of my day sitting in a class. But I'm really glad that I did because I learned a lot. And I think that's significant. Nurse leaders don't have a lot of time, as you know, and they're pulled in many different directions. And they lack learning and they lack tools to help them do their job on a daily basis. When it comes to BRG, some of the feedback was they would appreciate this course very early in the process of a BRG engagement because it gave them tools that would have helped during process improvement and change management.
I understand some of the participants in the latter sessions heard about how great this training was. And so not only did they prepare by reading the material in advance, but they also brought a stuffed monkey to the class.
They did. And that's when I knew that was going to be a very fun class.
So who has a pet monkey and why did they bring it? I guess is my question.
So one of the sections of this course is delegation. And there is an article that we request that attendees read prior to attending. It's a Harvard Business Review publication, Management Time, Who's Got the Monkey, which was originally published in 1974. It's been republished many times since then. And it talks about leaders working with their team, and monkeys are tasks, and how to grow your team to manage their own task so that the leader doesn't become overwhelmed by staff continually bringing monkeys and the leader taking on more monkeys than they can manage. So it's a tool-based article. And even though it was written in 1974, it's very relevant to leadership in the modern environment.
Yeah, really, it's encouraging people to own their own work and get away from micromanaging, to put it bluntly.
Yes, that's true. And the environment was different in 1974 from a command and control, from a leadership perspective. But still, in today's environment, it's very easy for leaders to take on tasks in passing. And before you know it, you've taken on 20 tasks in the matter of 20 minutes. And so this is teaching leaders how to manage those tasks.
Yeah, it's really also about empowering frontline staff too.
It does allow you to grow your staff. And as you know from your experience in leadership, good teams and good leaders always want to grow their staff and give them the ability to become involved in the work they do and grow and make change. And this enforces that.
What are some of the other topics? You mentioned them earlier, but can you go through some of the topics and the key takeaways and why those topics are in this course?
Some of the topics earlier in the day are just about leadership behavior and operational leadership. And there's several subtopics, obviously, within those sections. One is the leader is always on stage. People are always watching you as a leader, and they use that old adage, what you permit, you promote. So it teaches leaders to be aware that staff are always watching them, even when they're not aware of it. Another topic is accountability. Accountability is extremely important. You can delegate responsibility, but you can't delegate accountability. And also, many people think that micromanaging and accountability are synonymous, which is not true. You can delegate tasks, but you have to follow up to assure those tasks are being completed. And then the afternoon has a lot of conversation around effective communication and crucial conversation. Crucial conversation can be working with an employee for corrective action, but it's also equally important using those tools to talk with a peer that you disagree with or talking with a leader that you report to with whom you have a disagreement.
Any closing thoughts as we wrap up this episode?
There's a quote that I use in my courses that organizations promote nurses beyond their level of competence. And what I mean by that is they take a good nurse and put a good nurse in a charge nurse role. They take a good charge nurse and put them in a manager role, but they don't always give the support and the training and the education to make the nurse successful in that role. I feel it's very important for nurses to get training in leadership, particularly as they progress through leadership levels. It allows them to become effective. It gives them tools to utilize, and it helps them become a good leader in addition to a good nurse.
Preparing your frontline leaders for success has been our episode topic. Lowell Hardin, thank you so much for joining me, and thanks for sharing about all the great work that you're doing in advancing knowledge, education, and experience for those frontline leaders in the organizations that we are serving.
Thanks, Nick. I appreciate the opportunity.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.